So, Dustin, thank you for answering some questions beforehand. I asked you about special needs. You said it is the physically sick, the physically injured, those confined to a wheelchair, those that require an oxygen tank and a respirator, and those diagnosed mentally ill or developmentally disabled. I guess my first question tonight is, do you know why we're prosecuting people in wheelchairs?
That would be a question for the prosecutor's, the state's attorney's office.
Yeah, I think so. I mean, I just thought you might know. And the same would be for respirators and oxygen tanks and all that.
Yeah, the one thing I would say is there's a division of government functions, and the judges will make the determination on who's remanded to my custody. That's the point that I was trying to make is I'm given inmates, and then I have to act in their best interest. I don't have the say on who comes to custody, who goes out of custody, things like that. So those would really be questions on the prosecution or on the judicial side.
You can comment on the availability in the Department of Health Services, in other words, where to put mentally ill people. What's the status in Illinois right now with facilities like that?
So currently I have 11 inmates, I believe, that have been found unfit to stand trial that are still in my custody that are waiting for the Department of Human Services to accept them. And so they can't be released on bond, even if they could afford bond. They can't be transported because the Department of Human Services has to accept them first. And so they're just kind of in my facility. And the way our facilities are organized or constructed is our isolation cells are downtown, and that environment is not the environment we want for somebody who is in custody who already has mental health issues. So that's one thing that this consolidation will look at is if they have to be in custody in the first place, and there's nothing else, no other assistance we can provide them. We got to provide them the best assistance possible, and that's what the consolidation really will do.
Okay. Question for the architect. So when is this going to be done, if we started right now?
So we are in the construction documents phase as the architectural process goes along. Mm-hmm. We're submitting 50% construction documents to the county this month. Our schedule is to be able to go out to bid in October, accept bids in November, I believe, and start construction, start construction immediately thereafter. Now, that's not necessarily a good time to start construction, but a lot of things have a lot of long lead times to order, so all that kind of thing can be done. We're currently projecting about 18 months of construction, so about middle of 2024 completed.
So, Dustin, if your population doesn't change, we're spending another $2 million next year to house out-of-county inmates, right? If the population doesn't change.
That's correct. This was kind of, the conversation has, last year, I don't know if you all kept up with the county board or not, but last year the county board approved a plan to close the downtown jail. And then we had an increase in population, and it didn't make sense at that time to house out of county when we still had space here. And then with the gun violence and things that occurred in the community, now we are still housing out of county, even without the 140. So we had 70 out of county and 70 downtown. The staffing shortage that I was experiencing contributed to the immediate need we need to just take action and get this place closed.
Okay.
Yep.
All right. So, I mean, Dustin, if you can quickly, can you explain why the sudden jump in population? 2021, it was 213 a day. Suddenly, we're at 304. Can you give a short explanation why that happened?
Well, the simple answer is arrests have increased. And so I can't remember if I went into it a little bit in my letter or not. However, we continuously, and by we I mean the judiciary, the state's attorney, and I, continuously look at that list of inmates that are in custody, and it's actually available online and it's updated daily, so you can see the inmates who are in custody, the offenses they're accused of committing, and everything like that, looking for reasons that we can try to get them out and maybe better serve with community alternatives and things like that. That is very, very, very difficult to do. We are even still issuing notice to appear on warrants for failure to appear just because of our jail population and how increased it is.
Okay. We talked about programs. You have 17 programs for males and 8 for women. You told me that you're trying to get those programs back up and running. So where are we at, and what's going to go on? How are you, like, over the next 2 years as we're waiting for the new building, are you going to be able to do that stuff?
We are. So the main reason why we stopped programming was because of COVID-19.
Right.
Volunteers who a lot of times are elderly didn't want to come in and risk getting COVID-19. As you can imagine, in our population, it's vulnerable anyways. We didn't want COVID-19 running rampant in the jail. And so that's where we cut back our programs. We have actually started implementing them back in. Now, the good thing about this consolidation project is we call it classification. And so, for an example, inmate A can't be around inmate B, who can't be around inmate C. That's where our complication comes. That's why when I say technically we have 295 beds right now, but we are full at 212, I would say, because certain inmates can't be around each other. Well, obviously, that really comes into account whenever we're talking about programs. And so if you can't have 15 inmates together, you may not be able to find somebody to come in and do a program 15 times. You know what I mean, if they can't all be around each other. The good thing about this consolidation project is not only will there be 2 big classrooms, we have one currently, so we'll add a second classroom, but we'll also add some program space in those special management pods. And so we don't necessarily, if somebody has behavioral issues, we don't necessarily have to take them all the way through the jail in order to get programming. We can actually take the programming to them and still do it in a safe manner.
Okay, great. Will there be a doctor and a nurse staffing the jail 24 hours a day? 7 days a week?
No, we do not have 24/7 coverage. Right now, I believe we have about 18 hours a day of coverage, and the doctor is there, I believe, 8 hours a week.
Okay. Will inmates be able to contact medical staff, either a nurse or a doctor, at all hours of the day to report symptoms?
Yeah. So generally, we have a medical request form, and if a nurse is there, they will immediately address that need of the inmate. If it is something that appears to be needs addressed when medical staff is not there, then we send them out to the hospital. Generally, Carl Hospitals, where we send them to, we err on the side of caution and make sure we get that person evaluated. Our medical staff is available 24/7 for calls, and that's answered by a doctor. And so, the majority of the time, my staff, if there's not a nurse on scene, my staff will contact the doctor, describe the symptoms and things, and 9 times out of 10, the doctor says, "Go ahead and send them to the ER. Let's get them evaluated and then get them back." Yep.
That's great. I'm glad to hear that.
Yep.
I mean, Toya Frazier was before your time, but thank you for doing that. So can any inmate, whether sick or not, request a routine physical? Or is that too optional?
I don't know the answer to that question. I
It's
know
probably never
that every
come up,
inmate
right?
that comes in, there is I don't want to say a quick physical, but there is some type of general physical that has occurred. Now, we're not talking about the kind of physical you would get at your doctor's office annually. But, health questionnaire, things like that. But I cannot answer if every inmate who would request a physical would get one.
Okay. Can inmates get a second opinion?
I guess the second opinion would be going to the emergency room.
Yeah. Okay.
My experience, and we just transitioned to a new healthcare provider. My experience is that our healthcare providers will err on the side of caution. And so even for liability wise, if somebody's saying, no, I don't believe that's true, something else is going on, they're going to send them for a second opinion at the ER anyways. I don't want to officially speak on that, but that's been my experience so far.
Okay, great. Can inmates have access and communicate to their regular doctors on the outside should they have been under the care of somebody else before they came into the jail?
So that would be our nursing staff does try, and by nursing, American ACH. So they do try to keep that continuity of care. And so they will speak with Carl. They have access to the records for Carl and OSF and Christy to try to keep up with the medical history of an inmate. I can't say specifically whether they will call that physician and get specific guidance or not,
Right.
but I know they do have access to former medical records.
So it's possible.
Correct,
You might
yes.
say. Okay. Can they inmates receive copies of their medical records that they generate in jail?
Yes, I believe so.
Okay. Is there a process to file grievances if they don't feel like their medical care is, for some reason, is substandard?
Absolutely. And I cannot quote to you the length of time between a grievance and when a response is required, but there is a minimal length of time, I believe it's a couple of days, that our healthcare provider has to address that grievance one way or the other that the inmate has filed.
Okay, thanks.
Yeah.
Might be for the architect. Are the sick inmates on the single occupancy cells, will they have a toilet and a sink?
Yes, every cell has a toilet and a sink.
Of the new cells, right?
All the new cells have
Yeah,
a toilet
okay.
and a sink, yeah.
Sheriff, could you maybe, or whoever can answer it, is there a distinction between solitary confinement and single occupancy cells?
So right now, I would, and I'm not going to take a poll, but I would, if anybody's been to the downtown jail, you will see that we would consider our isolation cells as solitary confinement. At the consolidated facility, the good thing is, and why we did it with 4 or 5 individual cells, is because they're still going to have windows. They're still going to have a little day area, and Chuck, you can correct me if I'm wrong. But right now, their movement is limited because of their behavioral issues or things like that. There's just nowhere to let them recreate. However, we would be able to give them a little bit more space in the single occupancy cells that then have that commons area as well. So maybe 2 of them can be out at a time as opposed to just having to be out individually. It really does help us use our space better and really get the inmates as much as we can give them while they're in our custody.
Sheriff, could you talk about the legend that I hear about the naked room, where inmates are stripped naked and put in an isolation cell? Do you know why that's done?
Sure. So I'm assuming you're talking about the green gown on suicide watch. And so basically what happens is if an inmate comes in and they say they're suicidal or they don't answer questions about suicide, we assume that they're suicidal. Now, that is a overall jail that's not necessarily unique to the Champaign County Correctional Facilities.
Right.
That is a way that jails operate in order to help ensure that the inmate's not going to harm themselves.
Who's conducting that examination? The correctional staff?
Which examination?
Well, the determination that they're suicidal.
Yes, so there's a mental health questionnaire that is given to every single inmate that comes through the door. And then if there are indicators that somebody may be suicidal or even homicidal, mental health staff will follow up with them, yes.
Okay, so they're not actually naked, they're in a green gown, is
Correct.
that correct? Okay. Are they given a blanket?
I believe so. But at a minimum, they're given a green gown to cover up.
Okay.
Yes.
Will the sick inmates be allowed to socialize, like play cards and interact with other people in that kind of that 6 medical unit area?
Yeah, unless their classification would require them to not be around anybody else. Absolutely. That's one thing that this consolidation will accomplish is now they actually get that interaction as opposed to just being there by themselves.
Okay. Will some inmates be, obviously you're dealing with mental patients as well. Are some of these, is there ever a time, is it necessary to put them in 4-point restraints? I'm thinking of a bed and 4-point hands, feet, shackled.
No, that would take a medical order. in order to do that. There have been times where we have had to restrain inmates from self-harm. However, that is on recommendation of medical staff.
And is that the restraining chair?
It could be, sure.
Okay. And how long are they left in the restraining chair?
I can't answer that question, but I know as little time as possible.
If they spit on correctional staff, will a spit hood be placed on them?
No. Not that I'm aware of.
Really? Okay. Do you have a taser policy?
We do.
Okay. I noticed in your annual report from 2021, you don't keep track of use of force. I'm assuming that use of force, the 108 that you cited, was for the deputies on patrol, correct?
That is correct.
Okay. And are you keeping track of what the correctional officers are doing?
We do. Actually, correctional officers are required to write a report every time a use of force above and beyond normal escorting and things like that. They're required to write a report on that.
Okay.
And using a taser, even activating a taser but not tasing somebody, would result in a report.
So you have a count if somebody FOIA'd for
Absolutely.
that? You could do that. Okay, thank you.
To the best of my knowledge, yes.
Okay. So when an inmate expresses depression and suicidal thoughts, are they just left in the single cell by themselves most of the time, or do they have access to psychiatry or social workers or even family?
So we have mental health staff that are full-time. They're not there as much as regular nursing staff are. I believe they're there 40 hours a week. And that also includes psychiatry services. A certain amount of hours a week, yes. So they are generally, if they need extra attention, so usually suicidal, then they would be put in a cell by themselves, if possible, and then the mental health staff would follow up with them.
Okay. Are mentally ill inmates, are ones that are diagnosed mentally ill, are they forced to take psychotropic medications, do you know?
They are not.
So
Not
they could
unless we have a
refuse
court order.
medication if they wanted to.
What was the last part?
They could refuse medication if they wanted to. Is that what you're saying?
Yes, there's actually been cases where we've had to go before the judiciary and attempt to get a court order for our staff to do medication.
Okay.
And so, yes.
Will police detectives be allowed to conduct criminal investigation interviews while they're sick on the medical unit at the county jail?
I can't answer that. That would likely be a case-by-case basis.
It's possible, though.
Sure.
Okay. Will any utterances that sick inmates make while medicated, while on the unit, be used as evidence against them in court of law?
I cannot answer that.
You don't know? Okay. Will sick inmates who are undergoing drug withdrawal symptoms be pressured by law enforcement to snitch on their dealers?
I cannot answer that.
Okay. You don't know if it's ever happened, or it's just too much detail. Okay,
Yep.
that's fine. So will the medical unit be able to perform emergency surgery?
No.
No.
So
That
when
would-
you think of a medical unit, don't think of somebody needing immediate intervention. Think of somebody with a CPAP machine, for an example, or somebody, who has, let's just use it as an example, has been shot in the past and they're still doing some wound care, but they don't need the direct care of a physician. That is the type of medical unit we're running, not necessarily that 24/7 nursing staff there at your bedside because you need that immediate attention.
Mm-hmm.
No, we would send those out to the hospital immediately.
Okay, great. Are inmates allowed to talk to that are on the sick unit allowed to talk to their attorneys?
Sure. Inmates are always allowed to talk to their attorneys.
Okay, great. What about dental care, like an emergency dental? Would that be taken to the hospital again?
I would say emergency, yes. We actually have a contract with a dentist in Villa Grove that has regular checkups and things like that for inmates. But I would imagine in any emergency situation, it would go to Carl Hospital.
Okay, great. Will female inmates be allowed unlimited access to gynecologists, or? I mean, what kind of medical care is for female inmates? I mean, I imagine it's different. Also, you know, pregnancy or, you know, well, I don't know. How do you define all that? But
So our medical provider has certain protocol. That's why we contract out our medical services. So the medical provider has certain protocols. I will tell you that recent legislation, we have to give special treatment to females who come in who are pregnant, and so we have to make sure their bed isn't any higher than a certain height and things like that.
yeah. Okay.
How you doing there, Chris?
I'm almost done. Thank you. I appreciate your
Okay, just
patience.
checking.
Yeah. What about pain medications? You say there's a pharmacy on the new expansion?
Well, we currently have a pharmacy now.
You do? Okay.
Yes, and that is prescription. You know, medical staff have to approve meds and things like that.
Right. But can they get pretty much most meds if they need it? I mean,
Yes, and
if it's prescribed. I mean.
So our medical provider will stock common drugs, aspirin, things like that, and then they will also make sure prescriptions are filled if the physician does order something else.
Okay. I'm almost done, Sheriff. I appreciate your patience.
That's fine.
Who does the investigation in cases where a sick inmate dies in the county jail?
So in that situation, it would likely be a multi-jurisdictional task force, which is made up of officers from each individual agencies here in the CU area. So county would obviously take a back seat to that, and generally the state police would come in and they would lead that investigation.
Okay. Can family members of the sick inmate who died get access to the investigation and the results of the investigation?
By law, they're now required to, yes.
They are now required
Yes.
to. Okay, thank you. Let me see what else here. You know what, Sheriff? You did it. I have no more further questions. Thanks for everybody's patience.
All right, thank you, Chris.